Hello everybody, my name is Jasmine Asensio and today we'll be discussing applied behavior analysis in a sports and fitness setting. As we dive into today's topic, we'll be discussing about how applied behavior analysis can help with sports and fitness. We'll also be discussing the 7 dimensions of a BA and how it relates to sports and fitness, and we'll also discuss how to pursue this subspecialty in ABA if you decide that you want to learn more about it. So how can applied behavior analysis help with sports and fitness? The BACB, under the specialty fact sheets of behavior analysis and health and fitness, describes it as behavior analysts apply behavior analytic concepts and principles to improve personal health and fitness, primarily outside of the formal healthcare system, with a focus on health promotion through diet and exercise modification. So let's talk about it. First, we'll be looking at an article by Boyer et al. Titled Video Modeling by Experts with Video Feedback to Enhance Gymnastic Skills. The purpose of this was to present a study to examine the effectiveness of combining video modeling by experts with video feedback on the development of 3 complex gymnastic skills. The participants consisted of 4 female competitive gymnasts from the ages of 7 to 10 years old. All 4 participants received prior training in a gymnast club located in Southern Florida. Each practice lasted about 3 hours for 3 days a week, but only 30 minutes of each practice was used teaching the skills for this study. So the clips presented were expert models that engaged in these 3 skills, and they were performed by the USA national team members participating in the 2006 USA Championships. The target behavior assessed in the study included a backward giant circle to handstand, a kip cast, a clear hip circle, and data was collected using a 28-item checklist for each skill, with each component scored as either correct or incorrect, resulting in a percentage correct for each trial. The effects of combining video modeling by experts with video feedback were analyzed with 4 female competitive gymnasts, as we talked about a little bit earlier, in a multiple baseline design across behaviors. Baseline data was collected for the 3 target behaviors under normal practice conditions and provided consistent verbal feedback for each dismount as the coach usually would. During the intervention, there is a video modeling of by the experts with video feedback and required the gymnast to perform the target skill. And then after, she would walk up to the computer, and then the computer technician told the gymnast, try to match the expert gymnast on the left. The gymnast would then view the left computer screen and it would show the expert gymnast performing the same skill, followed by her own video performance on the right screen. After watching the 2 successively to each other, the gymnast then viewed the 2 video clips side by side, and the technician freeze-framed each clip at 5 different points for that skill. The technician played the expert model of the skill again at normal speed, followed by the gymnast's own performance of the skill at a normal speed. Each session lasted about 50 seconds or so, and the gymnast then attempted the skill 2 more times. As she completed a set of 3 repetitions of the skill in total. The gymnast did not receive verbal feedback from the technician or any research team member, and the coach continued practice as usual, using verbal performance feedback without the video procedures. After the final intervention session, a follow-up assessment was conducted weekly without video modeling and feedback. The results of the study indicated that exposure to intervention improved skill performance more quickly than regular practice and coaching alone. These results suggest that adding video modeling by experts and video feedback to typical coaching and practice techniques could reduce the number of practice sessions required to improve such a difficult physical skill. The next article we'll be discussing was written by Van Wormer. It was titled Pedometers and Brief E-Counseling, Increasing Physical Activity for Overweight Adults. The purpose of this experiment was to test whether pedometer aided self-monitoring and brief e-counseling could help overweight adults increase their physical activity. There was a total of 3 participants, 2 female, one was 32 years old, the other one was 52 years old, and then 1 male participant who was 48 years old. This experiment was conducted using a multiple treatments reversal design. The physical activity was operationally defined as any activity that resulted in a step recorded by the pedometer. Weight was measured on the first day of baseline and every Friday thereafter using the participants' home scales. The participants recorded their weight in the morning before breakfast, and there was different phases of this study, which included baseline, self-monitoring plus e-counseling, and a follow-up. During baseline, participants wore their pedometers blinded by a sticker to prevent any activity feedback. Participants removed their sticker at the end of the week and divided their total by 5 to record a daily average for that week. During self-monitoring, participants wore the pedometers unsealed and recorded daily step totals each night on the spreadsheet. During self-monitoring plus e-counseling phase, researchers added a basic counseling component that included one scheduled email conversation, which lasted about 10 minutes per week with the experimenter. For the results, all participants increased their steps during treatment phases. 2 of the 3 participants doubled the number of steps taken during their treatment phases. During the duration of the study, one participant lost a total of 12 pounds, another lost 5 pounds, and the last participant lost 3 pounds. The third and final article we'll be talking about today was written by Robson Ward, titled The Effects of Public Posting, Goal Setting, and Oral Feedback on the Skills of Female Soccer Players. The purpose of this study was to assess the effects of the intervention on the ball handling skills of team members, as well to assess the extent to which improvements in practice performance generalized to gameplay, and to measure the acceptability of intervention in the coaches and players. There's a total of 3 female players from a middle-class high school soccer team that participated in the study, and the participants ranged in the ages of 15 to 17 years old. All 3 participants have been playing soccer for at least 5 years. The study used a multiple baseline design across behaviors, and the study was also conducted over the course of the soccer season and consisted of 27 practices and 10 games. So there was 3 skills that were studied in total. The first one was movement after receiving the ball. This was described as occasions on which a player received the ball from a partner and then dribbled the ball for at least 5 seconds without losing possession. The second skill was movement during restarts. So players must move to an open space to receive a ball that is kicked or thrown to them when the ball is restarted after going out of bounds. The third skill was movement after the player had passed the ball. So this happened on occasions when a player has moved to a supporting position after they had just passed the ball. Data was collected during 30 minutes of practice scrimmages and games against other teams, and the games against other teams were videotaped. So during baseline, the team practiced, and it just went as normal as coaches would give feedback. They received the regular feedback and error correction of their performances from the 2 team coaches for all the skills during the practice sessions. For the intervention, it was consisted of public posting and goal setting and oral feedback. The head coach and lead author met with the 3 participants as a group and explained the target behavior, how it was measured, and the rationale for the 90% criterion. The players received praise for meeting the goals and encouragement if they did not. No other feedback was provided. Taking a closer look into the graphs, we can see here that movements with the ball, the data shows an immediate positive change from baseline to intervention for Amy and Jan. However, for Sam, it did have a delayed effect and it didn't go up until the second day. For movement during restarts, the data shows an immediate positive change from baseline to intervention for all 3 of them. So it was beautiful, it was perfect, and it's exactly what they wanted to see. For movement after passing, the data shows an immediate positive change for Sam, but it took a little bit more time for Jan and Amy. Although the performances of all the participants improved during the intervention, there were several occasions in which the participants didn't meet the criterion. But overall, you can see that they immediately go up for practices and games. So it was seen that the participants continued to perform the movement with the ball skill at the criterion level when the intervention was completely removed. And as you can see here, there are some variability here in gameplays, but for the most part, it is higher after the intervention than during baseline. How does ABA in sports and fitness fall into the 7 dimensions of ABA? So let's talk about applied. It addresses many social significant problems that impact the individual's life as well as their family's lives. So this could mean health benefits, right? So as we talked about the second article in which the individuals were losing weight, that is exactly what some people would need, especially if they're having health issues, right? So for someone that it's not easy for them to lose weight, we can use ABA to address those problems, as well as like if they're underweight, right? There are ABA protocols that we can provide that assistance for them to gain the weight that they need, especially during like pro seasons and pro athletes. That is their job. So using ABA, it helps them perform better in their jobs. It is behavioral as it consists of direct information, objective measurements, prediction control behaviors. In relation to sports and fitness, someone's health can dramatically influence their thoughts about themselves. Even such as athletes, their behaviors may have a bigger impact on their self-esteem and confidence when they're playing. It is analytical as it focuses on antecedents and consequences of a behavior in order to make data-based decisions on how to increase or decrease a target behavior. The use of an objective and controlled design that demonstrate having a functional relationship between the intervention and the observed changes in the target behavior. Researchers thoroughly and accurately describe their procedures while conducting research in a clinical practice. This means studies should be able to be replicated by other researchers. If a researcher followed one of the studies we discussed earlier, then another practitioner should be able to replicate the study and have similar findings. ABA in sports and fitness is conceptually systematic as it's based on basic behavior principles that are from empirical research that has found functional relation over many years by scientists involved in the experimental analysis process. Even looking at the 3 articles that we talked about today, you can see how researchers evaluated the data through visual inspection to make their decisions for their procedures. Looking back at the 3 articles of the soccer players generalizing to their games and forward, as well as our 18-year-old with autism that generalized his skills after 23 weeks after the intervention, as well as the participants that engaged in more physical activity and resulted in weight loss, and 2 of the 3 participants were able to maintain their weight and continue to generalize their new lifestyle and continue to double their physical activity. It proved it when improving the individual's quality of life. The goal should be to generalize these new skills to other settings. Supervisees pursuing their certification to become a board-certified behavior analyst can demonstrate mastery of the objectives from the task list. Here are just 5 of the objectives from the task list that can be met by practicing ABA in sports and fitness. The first one is distinguishing among behaviorism, the experimental analysis of data behavior, applied behavior analysis, and professional practice guided by science of behavior analysis. The second one is defining and provide examples of discrimination, generalization, and maintenance. That was a key points for all of our articles that we talked about today. Making sure they generalize, probing that afterwards. Did they maintain afterwards? Establishing operational definitions of behavior, right? So what does it mean to pass the ball and move and find that space? What does it mean to increase physical activity? And what does it mean to be able to thoroughly clean a bathroom? All of those had operational definitions that the author specifically wrote about so the reader could definitely understand and replicate that in the future, as well as recommending intervention goals and strategies based on such factors as clients' preferences, supporting environments, risk constraints, and social validity. All of the articles talked about social validity in a sense of like, do they have any feedback that they would provide them? Coaches were happy with the type of progress that their players were making. Our 18-year-old with autism didn't have any feedback for something different when learning how to clean bathrooms and work the dishwasher, etc. Also making database decisions about the need for ongoing services, right? So all of them have beautiful graphs in which they continue to collect data on and made decisions based off of those. Here are just some ethical codes from the BACB ethical book that you can continue to fulfill by practicing ABA in sports and fitness. So 2.01 is providing effective treatment behavior analysts prioritize clients' rights and needs in service and delivery. They provide services that are conceptually consistent with behavioral principles based on scientific evidence and designed to maximize desired outcomes. For example, our clients here that are athletes, right, we want to make sure that our procedures are conceptually consistent with our behavioral principles and use design procedures that make sense and our scientific evidence. 2.08, communicating about services, behavior analysts are use understandable language and ensure comprehension of all communication with clients, stakeholders, supervisors, and trainees. So especially in sports teams, you're working with not only the athletes themselves, but you're also working with their trainers, their coaches, their parents as well if they're minors, and everybody around them. Just making sure that everybody understands what exactly is going on and why, um, as well as explaining their assessments and behavior change interventions before implementing them, um, and be able to as well interpret the results to them. So 2.14, selecting, designing, implementing behavior change intervention. Behavior analysts must select, design, and implement behavior change interventions that are 1, conceptually so consistent with behavioral principles, 2, based on scientific evidence, and 3, based on assessment results, 4, prioritize positive reinforcement procedures, and as well as best meet the diverse needs, context, and resources of the client and the stakeholders. So behavior analysts also have to consider relevant factors. So, do they have any health side effects here? Like, do they have anything that may affect their like heartbeats, or does their sugar drop? Do they need to keep that in consideration? Especially as like the cost effectiveness and design and the implementation of behavior change interventions to produce the outcomes likely to maintain under naturalistic conditions. So, what kind of reinforcers can they set in order to prolong these new skills and continue to have them maintain and generalize over time? So if you're asking yourself, what can I do next in order to explore more into depth of ABA in sports and fitness, here are some options for you. I highly encourage you to join the Behavior Analysis in Health and Sports and Fitness, which is a subspecialty group. And the link is also posted here, so you can go ahead and click on that if you choose. There's also a lot of like Facebook, LinkedIn, and like Twitter specialty groups that I highly encourage you to kind of just explore and like reach out to people, as well as like attend conferences and extend your context that way, and as well as conduct your own research with different sports teams individuals. Obviously, if you've never done something like this before, please look for supervision and consultation first. But I do think it would be a very cool learning experiences as long as you have the right tools and are competent enough to conduct a study in sports and fitness.